Yes, guys, you are most welcome to my session. My name is Abdrazak. In today's lecture, we shall be looking at the management of acute coronary syndrome, and then we shall end with the possible complications of acute coronary syndrome. So to begin with, we shall look at what acute coronary syndrome means. It's just a medical emergency that occurs when there is a sudden cessation or decrease and blood flow through the coronary arteries, which will lead to cardiac ischemia. Then briefly, we shall look at the risk factors for acute coronary syndrome, which include hypertension, diabetes mellitus, dyslipidemias, smoking, tobacco use, family history, and then obesity. All those can predispose someone to have acute coronary syndrome. So we shall straight go to the management of acute coronary syndrome. The management, we shall look at how we can first manage the patient's symptom, because most of those patients come with chest pains, and others may be having nausea and vomiting. But for the chest pain, we mainly use morphine to treat the patient's pain. And then some patients may come when they are really desaturated with an oxygen saturation less than 90%. So we could still opt to give oxygen therapy. Then we can also give vasodilators. We can give nitrates, which will dilate our vessels to try as much as possible to boost blood flow towards the heart muscles. Then we can give the high dose aspirin, which is an antiplatelet. We can use a high dose aspirin, about 325 milligrams. Then on top of that, we can also add clopidogrel, a high dose. Still, we can give 600 milligrams of it on top of the high dose aspirin. Then some patients will be coming with dyslipidemias. We have seen it being one of the risk factors. So you can still opt to give the high intensity statins. You can give atorvastatin. It's a good choice. Then we can still give a beta blocker. Since acute coronary syndrome, it can occur when there is a mismatch between blood supply to the heart and the oxygen demand by the heart. We can also opt to give a beta blocker. We could prefer giving metoprolol, but the contraindication for use of the beta blockers for heart conditions, we shouldn't give it. And bronchospasms, if someone has asthma, we shouldn't use beta blockers, because they can precipitate the bronchial spasms. Then we shouldn't give beta blockers in case there is an atrioventricular block. Then also in cases of congestive heart failure and brittle diabetes. Those are the four contraindications of use of beta blockers in acute coronary syndrome. Um, Also, we can also use the anticoagulants to decrease possibilities of formation of a thrombus. We can use the low molecular weight heparins. We can use the enoxaparin. Yeah. Now, those are uh, the brief about the management, possible management of a patient with acute coronary syndrome. So we shall end with the complications of acute coronary syndrome. There are early complications and those that come with the time. So for the early complications of acute coronary syndrome, we have arrhythmias, abnormal rhythm of the heart. We can have arrhythmias coming into play as one of the complications of acute coronary syndrome. We can also have a myocardial rupture, because there is a possibility of us having a transmural infarction, mainly in the ST elevation MI. there's a transmural infection, and the heart walls will be very weak, and that can predispose us to having a myocardial rupture. We can also have an acute heart failure due to acute coronary syndrome. Then pericarditis, it's one of the possible complications of acute coronary syndrome. Then also pulmonary embolism. Then lastly, looking at the late complications of acute coronary syndrome, we have two. These are the Dressler's syndrome and chronic heart failure. Thanks for listening me. Don't forget to watch and subscribe to my channel. Thanks.